Welcome back to Senior Health Tips, where we help you stay active, independent, and pain-free as you age. Today, we're talking about one of the most common challenges seniors face: knee pain. Whether it's arthritis, past injuries, or simply the wear and tear of time, knee pain can make everyday activities harder than they should be. But here's the good news. You're not stuck with that pain. There are simple, safe, and effective exercises that can help reduce knee pain, improve your strength, and keep you moving. And the best part? You can do most of them right at home, no fancy equipment needed. Let's start by understanding the knee. Your knee is a hinge joint, like a door. It bends and straightens. But unlike a door, it's not made of metal. It's made of bones, ligaments, tendons, cartilage, and muscles. As we age, the cartilage that cushions the knee can wear down. That's where osteoarthritis kicks in. But movement is medicine. When you strengthen the muscles around your knees, like your quadriceps, hamstrings, and calves, you reduce the pressure on the joint itself. It's like adding strong support beams to take the load off a tired wall. So let's begin with exercise 1, the seated knee extension. Sit on a sturdy chair. Keep your feet flat on the floor, knees bent. Slowly lift one foot, straightening your knee as much as possible without locking it. Hold for 5 seconds, then lower it back down. Do this 10 times on each leg. This helps strengthen the quadriceps, the muscles at the front of your thighs, which play a huge role in stabilizing the knee. Don't rush. Breathe. Take your time. Exercise 2, the heel slide. Lie down on your back on a mat or your bed. Bend one knee slowly, sliding your heel toward your bottom, then slide it back out straight. Do this slowly 10 times on each leg. This keeps the joint mobile and gently stretches the muscles around it. Exercise 3, straight leg raise. Lie down on your back, one leg bent, the other straight. Tighten your thigh muscle and lift the straight leg about 6 inches off the ground. Hold for 5 seconds, then lower. Do 10 reps per leg. This strengthens your hip flexors and quads without stressing the knee joint. Exercise 4, calf raises. Stand behind a chair, holding it for balance. Slowly rise up on your toes, then lower back down. Do 15 slow reps. This works your calves and improves circulation. It also helps with ankle stability, which supports your knees indirectly. Exercise 5, hamstring curls. Stand behind a chair, lift your heel toward your buttock, bend in the knee. Hold for a moment, then lower. Switch legs. Do 10 curls on each side. This targets the back of your thigh, the hamstrings, which work together with the quads to stabilize the knee. Exercise 6, step-ups. If your knees can handle a little more challenge, use a low step or staircase. Step up with one foot, then the other. Then step down. Repeat 10 times, alternating the leading foot. This builds real-world strength for everyday activities like climbing stairs or stepping off curbs. Now, let's pause for a moment. Maybe you're thinking, what if it hurts? Here's the golden rule. Discomfort is okay, but pain is not. If you feel sharp pain, swelling, or something that doesn't feel right, stop and rest. Use a cold pack if needed. And always talk to your doctor if pain persists. Let's move on to some useful tips for managing knee pain beyond exercise. Tip 1, stay consistent. Doing these exercises once won't make a difference. Doing them daily or every other day will, think of it like watering a plant. You don't flood it once a month. You give it steady care. Tip 2, watch your weight. Even losing a few pounds can take a surprising amount of pressure off your knees. In fact, for every pound lost, there's about 4 pounds less pressure on the knees during walking. Tip 3. Use heat or cold wisely. Heat helps loosen stiff joints in the morning. Cold helps reduce inflammation after activity. Tip 4. Supportive shoes matter. Avoid flat or unsupportive shoes. A good pair of walking shoes can make a huge difference. Tip 5. Avoid deep knee bends, high-impact workouts, or sitting still for too long. Movement is your best friend, but it has to be the right kind of movement. Now, let's add something a little different. Imagine Mary, a 72-year-old grandmother. A year ago, she had trouble walking across her living room. Every step felt like a stab. But she started doing simple exercises like the ones we've just covered, slowly, day by day. Within 3 months, she could go to the store without her cane. Within 6 months, she was walking every morning with her neighbor. And now, she teaches a gentle movement class at her senior center. If Mary can do it, so can you. Your knees may be aging, but they're not done yet. Give them love, give them movement, and they'll support you far longer than you think. Before we end, here's a quick summary. Start with gentle exercises daily. Seated knee extensions, leg raises, calf raises, hamstring curls. These are your tools. Use them. Listen to your body. Be kind to your knees. And don't forget, you're not doing this to impress anyone. You're doing it so you can walk to the park, play with your grandchildren, and enjoy your independence one step at a time. If you found this helpful, please consider subscribing to Senior Health Tips. It really helps us reach more people who need this kind of support. And if you have a specific health challenge you want us to cover, leave a comment below. Until next time, take care of yourself, keep moving, and stay strong.